You're not going to have like joint dysfunction. It's going to be more like wear and tear, okay? Like overuse kind of deal, okay? So the first thing we're noting, right, as I'm looking at you, remember I was telling you about anterior rotation of the shoulders?
Yeah.
Well, your shoulders are kind of rotated forward here, okay?
Right.
So when your shoulders are rotated forward, this humerus is not in the position it should be in, right? So you should have right here, okay? And you should have better strength right in here. Are you doing upper back workouts as well?
Yeah.
Okay, and then neck. Are you doing anything for like any strengthening on the neck?
No.
No? Okay. I'm going to show you a couple of things that we can do to strengthen the neck as well for better posture. So as you're sitting there, like when we were talking, you're sitting like this, and so that right there, imagine this is rotated forward, so it's pinching this soft tissue here. So now lift weights with that, pinching the soft tissue. You know what I mean?
Yeah.
So that'll aggravate that tenderness, like right in there, right? Yeah. Right in there. That's kind of why you said it just happened out of like randomly.
Out of nowhere, yeah.
Feel it right here?
Yeah, all right there.
Right in there?
Ooh.
Yeah. So see how, if you strengthen right here and take that to a better postural position here, you're going to take that strain or that pinching right off of these joints here to improve that here, okay? It's going to still be tender though. But not as bad as when it was rolled forward, right? Okay. So that I'll show you a few things here. Probably what's going to be good for you is a good posture type of strengthening here. And look, when your body is like this, and your head is in a better postural position, that's kind of the look you're going for, right?
Yeah.
Like kind of more like rather than a hunch forward, look, right? Okay. So that's what you want there. So it's good for strength. Good for positioning, less pain, and it's what you're going for. It's the body image that you're trying to portray, right? Yeah. So let me have you lay face up here. We had talked about
put my face on there?
Looking up towards the ceiling. So we had talked a little bit about the sore knees, right?
Yeah.
You said that you used to run track. You noticed it when you would run track, like in high school.
Yeah.
And then you fell on your knee one time, had a bone bruise behind the knee.
Yeah.
So we're gonna be looking for like wear and tear behind the kneecap. Okay. Now, do you notice like when you're walking upstairs or when you're squatting or deadlifting, your knees cracking?
Yeah. After like a couple of sets, they start cracking.
Okay, and then does it hurt when that cracking is happening?
No, it hurts afterwards.
It hurts afterwards. Okay. I'm gonna check something out here. Okay.
Okay.
Relax your knee here. Okay. You feel that automatically?
Yeah.
The grinding. Okay. I want you to contract this muscle. Painful? Yeah. See how when it grinds, it causes pain in there?
Yeah.
Okay. This one here. Relax here for me. Feel that as well?
Yeah.
Can you contract this muscle?
No.
No? Is it painful with it?
Yeah.
Okay. I'm gonna help you up here. So remember when we were just talking a while ago about the possibility of grinding within the knees and that wear and tear kind of deal? So that's what we're dealing with. It's called chondromalacia patella. What that means is the cartilage behind the patella, and then the cartilage just in front of the lower leg bones are going to kind of wear down, and now there's going to be grinding and scrub and pinching on each other. Okay, that grind is going to cause inflammation behind the knee. So now when you lift, you go upstairs, work out, run, you're going to have sore knees. So a good support supplement would be like a joint support supplement, like glucosamine chondroitin, fish oil, vitamin D3. These are going to be good lubricants for the joint to keep them nice and supple, nice and balanced, right? To hydrate them. So you're going to want to use something like that as a supplement while you're doing your physical activity. Okay, it's just like are you taking any supplements right now?
I take like whey protein.
So whey protein does what? Supports what part of your body?
Well, like muscle.
Your muscle, right?
Yeah.
So protein helps grow muscle. Glucosamine chondroitin helps support the joints. It gives the joint the supple. You know what supple means? Like nice and full, right? It gives it a liquid. It gives it a fluidity. It gives it a lubrication, right? Smoothness, right? Now, I'm not saying that it's going to repair that grind. Yeah. But it's going to take the inflammation away. Okay. There are some glucosamine chondroitins, like some that we recommend here, that are going to have turmeric in it. Turmeric helps with reducing inflammation within the knees as well. So that inflammation reduction and that support, that joint support supplementation is likely what you're going to want to use as you're active. Okay. Be like if you have a sports performance car, you're not going to just do like the regular oil change. Yeah. You're going to do the performance oil change, right? So that's what you're going to do with your body. Okay. Glucosamine chondroitin with some turmeric, fish oil, and you should be good to go. Okay. We're going to check your low back here. Okay. So we're going to have you stand up for me. Stand right there facing the mirror. Okay. As you're facing the mirror, I want you to take your hands and put your hands on your pelvis like this for me, okay? Just take like a few steps in place and then focus on keeping your feet forward. And then, there you go, and look forward for me, okay? Let me get right over here. All right, you can stop right there now, okay? All right, I'm just looking at pelvic positioning here, okay? All right. You notice how one hand is placed a little higher than the other?
Yeah.
Just very slightly,
Just
not too,
bit.
like this is slightly higher than the other side, right? Okay. All right. Another thing that I'm noticing is your hands are also kind of rotated forward, okay? You have flat feet?
Do what?
You have flat feet?
Oh, no.
No. Take your shoes off for me. Okay. And I want you to stand there. Okay. Very good. All right. Take a few steps in place for me. Okay, you can stop. Okay. So I want you to have a seat right here for me at the edge of this table here. You can move your hands down from where they're at. Okay. Good. And then from a sitting position, come to a standing position. Okay. Very good. Okay. So do you feel like you have more low back pain when you lift heavy?
Yeah.
Yep.
Definitely.
Okay. So when you load your feet, just by watching you from going from a seated to a standing position, your feet kind of like want to give a little bit, okay? So likely when you're loading with a lot heavier weight, your feet are going into a flat position. The reason I'm checking that is because when I'm looking at how you have your hands placed, they're kind of slightly elevated this way. So that means that your pelvis is going to kind of be like locked out like this, okay? So that strain on the low back will definitely cause low back pain, okay? So inside your shoe, as you're lifting, you might want to have orthotics, and look at your shoes, right? Look at how they're what's happening. They're both rolling in, right?
Yeah.
Right. So that tells me that when you walk, you're walking inside.
Inside.
You're rolling in, and your arches are dropping there. Okay. So that roll in on the feet, right, is going to cause your knees to put more pressure here in the middle, and it's going to rotate your pelvis this way, putting more pressure on your low back.
Yeah, because like it doesn't hurt, but it feels weird when I keep my feet straight. I'm
Right.
used to having my feet.
You have to
like
You have to get them in a different position to have better balancing.
Yeah.
Right. So now whenever you do have your shoe like this, and look at the inside of your support, they're completely worn down.
Yeah, because I have the things that you're talking about, but
The orthotic.
yeah, but it feels weird when I.
Where'd you get it at?
I think I got them at like Walmart or something.
Well, okay, so what you want to probably go do, there's a good store like Virginia Runners. There's a running store in
Woodbridge.
Gainesville. There's one in Woodbridge, right? You can go into the store and have them do an analysis and get you one. They're not super expensive. Sometimes if you get like a pre-ordered foot orthotic, like from a ordering company or a fitting company, you're paying a lot of money. These you can get some decent orthotics, put them in your shoe. They'll kind of measure you and see what you need in order to give you better stability. But the ones at Walmart, like some of those are not good enough to kind of make a difference for you. Okay. Well, some of these like professional running stores will have something that'll help stabilize your gait, your foot arch, and then that'll help support the low back. Okay. I'm going to do a little bit of testing on the low back and just kind of see if they're called provocative tests. So they're supposed to provoke pain if it's there. We're going to do a little bit of provocative testing. So we got it. Okay. So let's have you lay face up right there for me. So lay on your back again, up towards the ceiling. Okay, and then without bending your knees here, lift both legs for me and hold them right there. Come back down about 45-degree angle. Right there, hold it right there. Don't let me push down. Any pain with that?
Yeah.
Yep. Where is the pain when you do that?
Like in my lower back.
Way in the way bottom, right?
Yeah.
And is that where you normally experience the pain whenever you're like after you're working out or whenever you're
around there, like from there to like right here.
Okay, I'm gonna help you up here. I'll help you sit up. Any pain when you're getting up like that?
No.
Okay, so remember, pain is not 100% of our analysis, but we're talking functionality. Now we're talking about the pelvis rolled forward. Now we're talking about flat feet. Now we're talking about when you get into a walk or into a gait, you're gonna now have restricted motion in the pelvis. Okay, pain is kind of like all of this is going on, and pain is just what's happening now. It's a symptom. So lay face down for me. I'm gonna feel mobility in the low back here. Okay. All right. Good. Okay. We look at foot length here. Okay, it's actually not terrible. The right side looks slightly higher than the left. Okay. Tender in here.
Yep. Right. Where your thumb is.
How about in here?
A little bit.
More down here than up here.
It's like right here and
Like
then
right there? Okay, right here too?
Just
Nope.
on the other side.
In here? Right in here?
Yeah, right there.
Right in here?
Yep.
And most of your issues on this right side?
Yeah.
Okay, all right, very good. We do got some tight muscles in here, okay? So we're gonna do some things to try to loosen this up here. From right in here, we're palpating really next to the spine here, and we have some irritation, okay? So any pain in there or tenderness?
No,
Nope.
just lower it.
Okay, so we definitely have some, we'll talk a little bit, so you can have a seat. Some imbalancing in the pelvis, okay? Some lack of what's called mobility or range or motion, segmental motion in the pelvis as well, in the lower lumbars. When I'm palpating, you've been to the dentist?
Yeah.
They kind of poke your teeth, they check, and they find a soft one or a tender spot. It's like, oh, that kind of hurts, right? We did the same thing with my hand. So we shouldn't have nerve irritation in the low back. You do have nerve irritation in the low back. So there's some spots that we got to. It's like it's in there. And when I'm palpating that, I'm right near where the nerve root comes out of. So there's some inflammation there. It's only on one side, not the other, right? We have some tightness in the low back, some tight muscles that can attribute to it. So chiropractic in general, I'm not foreseeing that if I looked at an MRI or an X-ray that I'd see some major compression, disc bulges, or herniations like that. I'm not saying that they're not there, but I'm not projecting that that's what I would see. I think for you, if you buy the foot orthotics, right, work on your foot support, work on strengthening your psoas muscle or your hip flexor muscles, okay, and take some of the pressure off of the hips. The occasional chiropractic adjustment will help you maintain spinal alignment and spinal health. And I think it'll be strongly beneficial for you. Glucosamine chondroitin doesn't only work for your knees, it's also going to help your joints within your spine, okay? So having a supplement like this, it's going to support your spine, support your SI joints, your knees, your shoulders, along with your exercise that you'll learn how to do for the shoulders, so on and so forth, are going to be what's going to be ultimately beneficial for you. Okay, so today we're going to get in here and we're going to provide some chiropractic adjustments, and we'll show some of the treatments that we use for these issues are like electronic stimulation, hot pack, soft tissue therapy. What we're going to do right now is we're going to get in here and do some adjustments in soft tissue therapy. Okay, so we'll have you have a seat right over here.